Welcome to another episode of Dental Flicks Uncut. We are here with truly one of my favorite people in the industry. We've got Dr. Eric Block on with us today. Eric, welcome to the show. We are so excited to dive in, but please first introduce yourself to our audience and share with them how you help the industry.
Pleasure to be here. Thank you so much for having me. Yeah, I'm a full-time practicing dentist outside of Boston. I've been practicing about 20 years. And to kind of sum up my story, I went through a tremendous amount of burnout about halfway through my career. And I started to go through therapy and coaching and I really figured it out of what was making me tick and why I was so anxious and burned out and stressed. And I was able to turn it around to get to the point where I love going into work every day. So I felt like I had a story to share with anyone out there that, any dental professionals that were kind of going through the same thing that I was going through, and to see if I could help any of them. And that's where my brand, The Stress Free Dentist, came from, and started the podcast. I started writing books, and it's just been kind of a passion project of mine.
Eric,
Hmm.
can we go a little bit deeper?
Let's go deep. Yeah. How deep do we want to get here? Um, give me a question to.
Yeah. I mean, this is Dental Flicks Uncut, and there's a lot of doctors right now. There's a lot of team members right now who are not okay. And there's a reason why you started this movement. There's a reason why you started the podcast, right? Like for me, I started my podcast because I knew how it felt to not be able to have any time with my kids or take a vacation, right? But then I also know what it felt like to be able to take time. And my coach asked me, "What's your legacy going to be?" Right? Like, how are you going to impact the world? And why does that even matter? Right. And so, why is this personal for you? Like, why does this matter? The movement that you're building? And why are you putting so much energy, effort, time into really helping so many dentists to be able to avoid burnout? And what's happening in their lives? What happened in your life? Like, why is this so important?
Yeah, so you mentioned the words, let's get deep, let's take a deep dive. And that's exactly what I did. When I first reached out for help, first of all, I thought there was something wrong with me. I thought I chose the wrong profession. I thought that I was gonna leave dentistry and go to law school because I was so afraid of getting sued. I was so afraid of getting a bad review. I was so exhausted at the end of the day. And it turns out that there's nothing wrong with me, that I'm more of a kind of an introverted person. The social aspect of the profession was really a grind for me, going from room to room to room and trying to give every patient that great experience. I was saying yes to everyone else. And what I learned was I really need to take care of myself first. And sometimes that means saying no to other people. And I realized there's nothing wrong with me. And you know what? I can handle this profession. It's tough. There's days that I get home, I'm exhausted. There's days that I get home and I just need to stare at the wall for a while. But that's going to happen. There's going to be good days, there's going to be bad days. But to understand that this is a high stress job that we chose, it's a high demanding, high stress profession, just like a lot of other professions out there. And the important thing is to understand that there's going to be ups and downs. This is a marathon and not a sprint. And there's going to be good days, there's going to be bad days, but the bad days won't break me. The bad reviews won't break me. The uncomfortable conversations I have with a staff member or a patient, those won't break me. And you know what? I'm going to focus on the 30 good things that happened during the day and not the one bad thing that happened. And I used to not do that. I used to get so wrapped up in my head about the bad things that happened, the filling that fell out, or the crown that didn't fit, or the bad review I got, or the fact that a patient wasn't happy with me and didn't want to rebook. I started not to care as much about that, and I started to care more about myself. And that was such a game changer for me. It was such a relief. And I know that a lot of dental professionals out there, they're isolated, they're in their own little bubble sometimes, they're in a private practice setting, possibly, and they have no one to engage with. They don't know where to turn to. And a lot of times they turn to drinking, they turn to drugs, depression, suicide, you name it. It can happen if you let these problems build up. I was there. I was at the point where I wanted to leave dentistry because the stress was breaking me. And my message to the dental professionals out there is it doesn't have to be like that. And but you have to take action. You have to do something, whether it's calling a coach, it's calling a friend, calling a mentor, a consultant. If you do nothing, then these problems aren't going to go away. So the sooner the better, but better late than never. And for me, it was halfway through my career. But what I really want to try to do is get to the young dental professionals to tell them if they're feeling the burn, if they're feeling depressed, if they feel like they're that they're in the wrong profession, reach out for help and do something. That's the real take-home message.
Dennis and I have been talking about vulnerability a lot lately and just really the power of it, the excruciating nature of becoming vulnerable. And everything that you shared, requires a level of vulnerability to even just access support or access help. How do you, first, how did you allow yourself to be vulnerable enough to reach out and ask for help? And how do you help others kind of recognize that that's the key to the first step towards things getting better?
I feel like I was just yelling at the two of you with my answer there. I don't know why that I was like so fired up there, but
We were so
um,
captivated though. We were like,
I feel like I was like lecturing my kids or something. But anyway, vulnerability is so important to not try to be perfect. I think dentists, dental professionals, you come out of school, you try to be perfect with your board scores. You want to graduate, you want to get into that residency, you want to pass your licensing exams, and then you get in the real world, and all of a sudden things aren't perfect, and you start to really beat yourself up. And if you can understand that things are not going to be perfect, uh, and that's okay, then the sooner you can realize that, the more productive career you'll have and the longer career you'll have. And to understand that people aren't going to like you, people aren't going to agree with you, but as a dentist, especially, you have to be a leader. And even if you're an associate, and especially if you're a practice owner, make no mistake, you are a leader. And for me, that was a big struggle. I struggle with being a leader every day. And it's if I could go back in time, I would take courses on how to be a leader, how to relate to people, how to work with people, manage with people. But to to understand that that's okay. We didn't learn anything about business or HR or management in school. We have to take it upon ourselves to learn these things after dental school. And you got to look at yourself in the mirror, and you got to realize that you're not perfect. There's going to be ups and downs, and that's okay. But you got to reach out for help. You got to get training. You got to get educated. You got to realize you're not perfect, and realize that there's going to be some good days and some bad days. But yeah, getting vulnerable and um, realizing that you're going to have some weaknesses, but to try to improve on those weaknesses. And everyone has weaknesses. Nobody's perfect.
So I think the biggest thing for me as a dentist as well is like getting to the point with the vulnerability of being okay to share with my team that I didn't know, right? Like I want to build an incredible business. I want to have more for you and your families. But the reality is I don't know how to run a business. And so that's why I'm making a decision to get a mentor, like, because I want to be better. And I think what happened with that was like so much respect. And, as I look at even last week, I was in speaking training for 40, 50 hours last week, right? Because I'm okay, but I want to be better. And as I was there, I shared this with Allison, like when you look at Allison's face right now, for those who are watching us, right? Like Allison has a demeanor. She always has a smile. It's just within her. Right. But for me, it's like I come off very like matter of fact and very hard. And like I'm having to like be more vulnerable and say, I want to have a smile more in my face. Right. Because ultimately I want to help people. And so I think the biggest thing that we can do is to know that we are good at what we're good at and acknowledge and accept that we are evolving in areas of where we're not where perhaps we would like to be. And there's no comparison, right? And so I think a lot of times we get stress is because we feel that we have to put on a show. Like we've got it all together, that we've got all of this money in the bank because we have doctor in front of her name, right? And that's just the furthest for the truth. And so we start to evolve when we start to reach out to people and say, I'm not all right. Right? Like, I am so not all right. And what did you do to become all right? Or learning to realize that it's never about a person, but it's more about there's just something that you just didn't know yet. Right. And so I think it's really powerful what you're saying, but like, I really want this episode because you have so much experience and you interview so many people. Like, I really want, and this is great, it's great that you've got a podcast, but it's really great for you to be on other people's podcasts, right? Because now the work that you're doing is being exposed to people who may never heard of Dr. Eric Block, right? And so I would love to just go a little bit deeper for those who are listening right now, and maybe they caught the title of this episode and they're like, this could be that moment right now as you're listening right now, where literally something happens. And today I'm not Anissa the podcaster, and you're not Eric the dentist, and she's not Allison, the amazing podcaster, coach, consultant, but we're here as messengers to deliver a message from the universe or from whatever being, to give a message to someone to be able to help them. And so what is that message maybe that's flowing through you right now that we can share to be able to help someone?
I got a bunch of messages floating around in my noggin. I want to go back to where you mentioned the words "I don't know," and that's okay, right? All of a sudden, we're leaders of a business, and staff are going to come to us expecting us to know the answer. It's okay to say, "I don't know. Let's find out." And same thing with patients. Patients sometimes they'll come to you with complex problems, and it's okay to sometimes say, "I don't know," or "I'm going to refer you to a colleague." So I think that understanding and owning those words, "I don't know," is extremely important. Um, the other thing was I let people into my life. I have barriers. I have very strong barriers, but I do let people into my life as far as patients and staff, but at a bit of a distance. But as I've done that and kind of being a little bit vulnerable with my life, it's helped me create relationships. And then you did mention the putting on a show thing. That was one of the biggest, most exhausting things of the profession for me, was going from my chair to another room, to another room, to another room, 8 hours a day, kind of always pretending to be in a good mood and trying to wow that patient, because let's face it, no one wants a sad, tired dentist working on them. So you got to always be on your A game. And for me, that was exhausting. Um, but to realize that that's okay, that's common. But I would say one of my biggest take home messages is remove any negativity, remove negative people from your life. Negativity will just soak up your brain. It'll get into your brain and make you unproductive. Remove, keep positive people around you. Keep people that will lift you up, that'll give you good criticism and good advice, but keep the negativity out of your life and reach out for help. If you're feeling down, if you're feeling like something isn't right, reach out for help and do it the sooner the better. We tell patients, take care of that cavity. If you don't take care of that cavity, it's going to get bigger and you're going to need a crown. If you don't take care of it, it's going to turn into a root canal. If you don't take care of it, it's going to turn into an extraction. You're going to need implant. Same thing with ourselves. If you're feeling like something isn't right, don't let it go. Reach out for help with your peers, your mentors, and take some action. So I would say keep positivity around you, remove any negativity, and take action.
And we have such a different world today than we did even 5 years ago or 10 years ago as it relates to the people that can help us. I think we now are starting to normalize therapy. We're normalizing coaching. We're normalizing healing. We're talking about trauma. Like these are words now that we use today that I don't think we talked about like 5 years ago, 10 years ago. If somebody was listening to this podcast and they were like, Eric, this is resonating with me and I do need help and I want to talk to somebody, where would you direct them?
Yeah, so that's such a great point. There's so much more awareness now, and there's so many more resources. When I was first going through, my struggles, I was a psychology major. I graduated with a degree in psychology, so I always knew that I wanted to go through some type of therapy, but a lot of dentists out there don't know where to go or don't know where to turn to. So there's the International Academy of Dental Life Coaches, or iadlc.com. And that's a place where if you feel like you're depressed or you're burning out, we'll match you up with a life coach that understands dentistry. Or if you just want to get to that next level, if you feel like you're plateauing and you want more out of your career, we can help you do that. Or you can check out my website and my books at thestressfreedentist.com.
Can you tell us more about the IADLC?
Yeah, so the IIDLC is an amazing group. Allison is one of the founding coaches, where we have such a diverse group of life coaches, and we have hygienists, we have dentists, we have full-time coaches, we have people that were in the admin or assistant portion of dentistry, men, women. We've got the whole range of coaches, because like I was mentioning, I went through coaching and therapy, but it was with people that didn't understand dentistry. I got great help from it, but dentistry is such a complex industry. To try to explain it to someone that's not in the industry is very difficult. So that's where the IADLC comes in, is that we'll match you up with someone that can help you, but they also understand the complexities of the dental industry.
I love it. And I think you're 100% right. It's important for people to be able to talk to other people that know what it feels like to be in their shoes or just like understand that industry. Um, Tell me a little bit more. Like, I think something that people have a misconception around, and like I'm very passionate about this as well, but the difference between therapy and coaching. Like, sometimes we look at like a life coach and we're like, what do you know about my life? Like, how are you going to help my life? But you've had a really positive experience with coaching. What was that like for you?
Yeah, so with therapy, that was more of, we went deep down into like my childhood, and we ended up going through some a mixture of prescribed medications that worked out for me, but it was more going back into my childhood, going backwards, where I feel life coaching is more, okay, let's go from here more towards the future. And the dentist is within you. You have the answers. We just need to pull that out of you by asking the right questions. So it's a very different form of help, but so powerful. And it's a way of even if you're doing well, a lot of times people think I have to turn to coaching because things aren't going great. that's not always the case. Even if you're doing well, but you want to even get better. Like Anissa was saying, she was at a speaking conference. Well, Anissa's extremely experienced with speaking, but she wanted to get better. That's what coaching can do. It hurts me to say this, but Tom Brady is one of the best quarterbacks to ever live. He left New England and went to Tampa Bay, so it hurts. But he had a coach. He had an arm coach to help him throw. Best quarterback ever. He had a coach. So if you're at 99% and you want to get to that 1% more, a coach can help you do that. But if you're feeling like you're at rock bottom and you're at 5% and you want to get up to 10, 25, 50%, a coach will help you do that as well.
I love that. Can you share a little bit more about your podcast?
Yeah, both of you have been on it. Amazing guests, great stories that you both share. It's really just a very laid back conversational style of podcast, even though it seems like for that last half hour I've been yelling at the two of you. It's really laid back. I just ask. I have leaders in the dental profession come on. Sometimes they're dentists, hygienists, vendors of companies, and they just share their stories. And the ultimate goal is to help dental professionals get more efficient, productive, and less stressed. And we share mistakes, failures, successes, kind of really dig into how people got into dentistry, and we try to cover it all. So uh, it's a typically about a 20-minute length episode, and the key is that someone comes away with some nuggets that they can take home.
And can you share again the name of the podcast for those that might be listening?
Yeah, it's the Stress Free Dentist podcast show, and just you can find me on LinkedIn or Facebook at the Stress Free Dentist, or just go to thestressfreedentist.com. You can find all my books, the podcast, any events I have coming up. It's all there.
I also want to thank you for being a content creator for DentalFlix. Uh, can you share a little bit more about what they can learn from you inside of DentalFlix and how you're able to be able to help dentists who might be listening?
Yeah, so I learned it from you, Anissa, when you said that when you first started to create your podcast or webinars, you just did it. If you're a content creator or you feel like you have content or something to share, get it out there. It may not be, The Godfather Part 2 perfect, but get it out there and you can always, make it better. But you got to start somewhere to share that content. And as an audience member or a viewer, there's so much out there, whether it's marketing or implants or how to self-help, mental health. It seems like that DentalFlix really has a great broad range for the audience. So whether you're a content creator and you feel like you need a platform to share your content, it's great for that too. But you got to start somewhere and just get it out there. Just it's so easy. You could do it on Zoom, record yourself on Zoom, and then record it and share it.
Oh, I really appreciate you, and I appreciate you saying yes and being a part of helping so many people to be able to grow. I know you've got a course in the mental health and wellness. You also have one in the clinical. So maybe you want to share a little bit about what you're doing on the clinical side.
Yeah, I have a course about dental implants. I've been doing implants for 20 years, and I just share my techniques and how they went from one of the most stressful procedures I did to one of the most enjoyable procedures. And that was by adding virtual 3D diagnosis and guided surgery, and just some kind of create I share my workflows with dental implants. I'm going to have a few more courses that I'm going to be sharing, how I went out of network and how I've added high value treatments to my practice. So a lot more to come. But thanks for giving me a place to share my videos. It's such a great platform.
Thank you so much for just I feel like you're one of those people that like just shows up for everything that you do. You show up with like complete authenticity, vulnerability, and that's why you're helping so many people. I think people look to you as just a very trusted advisor because you can feel the realness of you in everything that you do. And so if you're not following Eric on social media, on his podcast, like I highly recommend it. You're going to learn so much from him and you're just going to feel like you have a friend in everything that you're doing in dentistry. So Eric, it's been such a pleasure having you on the Dental Flicks Uncut podcast. And we're so excited to see what you're going to do in this industry because you just continue to innovate, grow, support the world that we live in. So thank you so much.
Oh, thanks so much for having me. Pleasure.
And if you can share just one more time for those that are listening right now that need help, how can they reach out to you?
Yeah, you can email me at eric@thestressfreedentist.com. You can go to thestressfreedentist.com to see my books, the podcast, events, and also go to the International Academy of Dental Life Coaches, which is www.iadlc.com.
That's incredible. I'm so excited to be able to learn more about you and what you're doing and share that resource. I know there's quite a few people I have on the top of my head that could definitely benefit. So thank you for being the leader and creating and having that vision, literally changing lives. And so thank you so much. Thank you for saying yes to being on this podcast today. Listeners, it's been incredible having you here for the last 30 minutes. We look forward to seeing you soon in the next Dental Flicks Uncut podcast. Take care and we will chat soon. You just unlocked valuable insights with Dental Flicks Uncut, but there's more. Dental Flicks is not just a podcast. It's a thriving community, a hub of knowledge, and the #1 online streaming CE platform in dentistry. With just a few clicks, you can start exploring a wealth of resources, including in-depth training on leadership, case acceptance, scheduling, hiring, weekly marketing calls, insightful gap assessments, and scorecards, all designed to help you master what you discovered today and propel you further on your path to dental excellence. Head to dentalflix.com to get started for free and embark on your journey towards mastery. Thanks for tuning in to Dental Flicks Uncut. See you next time.